Hello, I'm Rachel McKenty, Director of Programs and Development at Legacy Education. Thank you for joining me for the CPC, CPC, CPB Practice Exam Review. In this review, we will discuss ICD10 CM practice questions and how to answer them using the chapter-specific guidelines and some test-taking strategies. What does the seventh character A indicate in Chapter 19? A, initial, B, sequela, C, subsequent encounter, or D, adverse effect. Reviewing the guidelines, it states that A is for initial encounter, making A the correct answer. B is for subsequent, and F is for sequela. What type of fracture is considered traumatic? A, pathological fracture, B, spontaneous fracture, C, stress fracture, or D, comminuted fracture. Traumatic fractures are a result of a traumatic event, occurrence, or even extreme force, like a motor vehicle accident or a fall greater than a height of standing. Traumatic fractures will always be coded to Chapter 19 of the tabular list. A pathological fracture is a fracture caused by a disease that led to weakness in the bone structure, like osteoarthritis and osteoporosis. Stress fractures are indexed to category M84 in Chapter 13. In the ICD-10 CM alphabetic index, look for fracture, traumatic, spontaneous, cause unknown, which states to see fracture pathological, and all of these are considered non-traumatic. A comminuted fracture is a type of traumatic fracture where the bone is crushed or splintered into several pieces. And you can see an example of that on your screen to the far right. In the alphabetic index, look for fracture, traumatic, shaft, comminuted, referring you to S72.35, which is a code found in Chapter 19. The answer to this question, what type of fracture is considered traumatic, is D. What is not an example of active treatment for pathological fractures? Surgical treatment, emergency department encounter, evaluation and treatment by a new provider, or cast change. According to the ICD-10 CM guideline 1C19A, examples of active treatment are surgical treatment, emergency department encounter, and evaluating and continued treatment by the same or different provider. Cast change is considered subsequent treatment, and therefore the correct answer. It is not an example of active treatment. According to the ICD-10 CM official guidelines for coding and reporting, Chapter 19, Pregnancy, Childbirth, and the Puerperium, codes in this range have sequencing priority over what codes? Our choices are A, Chapter 15 codes do not have sequencing priority over other codes, B, all codes including Z33.1, C, codes from all other chapters, or D, codes from Chapter 1, certain infectious and parasitic diseases. According to the ICD-10 CM official guidelines for coding and reporting, Chapter 15 codes always have sequencing priority over codes from all other chapters, therefore making C the correct answer. What is the definition of postpartum complication? A, any complication occurring within the 6-week period prior to delivery. B, any complication occurring within the 6-week period after delivery. C, complications that occurred during the last month of pregnancy. Or D, any complications that occur 5 months postpartum. So A is out, knowing from our terminology that postpartum is after, not prior. According to the ICD-10-CM 1C1502, a postpartum complication is any complication occurring within the 6-week period following delivery. B is the correct answer. Any complication occurring within the 6-week period after delivery. Newborn twins are delivered at the hospital via cesarean section at 27 weeks, weighing 850 grams for twin A and 900 grams for twin B. Both were diagnosed with extreme immaturity. What ICD-10-CM codes are reported for both twins? And we have a list of codes. You can note on our screen here that 2 of the 4 start with P and 1 starts with Z38. In our ICD-10-CM guidelines, 1C16A2 indicates when coding the birth episode in a newborn record, assign a code from category Z38, live-born infant, according to the place of birth and type of delivery as the principal diagnosis. A code from this series is assigned only once to a newborn at the time of birth. So this should be the primary code on a newborn's very first claim to insurance carriers. In the alphabetic index, look for newborn twin, born in a hospital by cesarean, directing you to code Z38.1. Since Z38.1 is required to be in the primary position, only B can be the correct answer, but for practice, let's code it out. And if we are testing and we knew that the Z38 was to be primary, this would have saved us a lot of time on test day, knowing that B would have been correct pretty quickly on. Okay, in the ICD-10 alphabetic index, look for low birth weight, extreme with weight of 750 to 999 grams, directing you to code P0703. Additionally, look in the alphabetic index for immaturity, extreme of newborn, gestational age 27 weeks completed, directing you to P0726. We, of course, would verify all these codes in the tabular list. When doing so, there is an instructional note with the P07 code range telling us to code the birth weight before the gestational age. So that will help us with our sequencing as well. And B is the correct answer. And moving on, can Z codes be listed as a primary code? In the ICD-10-CM guidelines, 1C21A indicates Z codes may be used as either a first listed principal diagnosis code in the inpatient setting, or a secondary code depending on the circumstances of the encounter, of course. Z codes are not external cause codes, though. The external cause codes are listed in Chapter 20 in the tabular list and begin with alpha characters V, W, or Y, and can only be reported as secondary codes. So can a Z code be listed in the primary position? A, no, B, no, C, no, D, yes. We know the answer to B, yes, so D is the correct answer. Z codes can be sequenced as primary and secondary codes. In which circumstances would an external cause code be reported? B, delivery of a newborn. A, delivery of a newborn. B, causes of injury or health and condition. C, chemotherapy treatment of neoplasms. Or D, only the cause of motor vehicle accidents, only for the cause of motor vehicle accidents. In the ICD-10 CM guidelines, 1C20A1 states, an external cause code may be used with any code in the range of A00.0 through T88.9 and Z00 through Z99 classifications that is a health condition due to an external cause. Though they are most applicable to injuries, they are also valid for the use with such things as infections or diseases due to an external cause source. For example, if you were to get bit by something and got an infection from it, think like rabies from a raccoon. And also other health conditions such as maybe you had a heart attack while you were playing basketball or something of that nature. So in which circumstances would an external cause code be reported? And the answer is B, causes of injuries or health conditions. When a patient has a blood test for HIV that is inconclusive, what ICD-10 code is assigned? Z21, R75, B20, Z11.4. Let's review the HIV/AIDS guidelines. Coders should only use codes for HIV or AIDS if the diagnosis is confirmed. This means there must be documentation from a healthcare provider stating that the patient has been diagnosed with HIV or AIDS. In this context, confirmation does not require documentation of positive serology or culture for HIV. The provider's diagnostic statement that the patient is HIV positive or has an HIV-related illness is sufficient. If a patient is admitted for an HIV-related condition or illness, the principal diagnosis should be B20. If the patient is admitted with unrelated conditions, for example, a traumatic injury, then the unrelated condition would be the principal and B20 would be secondary. Whether or not the patient is newly diagnosed has no bearing on the sequencing of the B20. When a patient is without any documentation of symptoms, the patient is considered asymptomatic. The correct code selection for asymptomatic is Z21. If documentation does appear in the chart with wordings like AIDS or HIV disease, or if the patient is treated for any HIV-related illness, then use B20. Also, patients with known previously HIV-related illnesses should be coded to H20. In essence, once a patient has been diagnosed with HIV or HIV-related illnesses, B20 is all you'll use, and you should never assign R75 or Z21 to that patient again. So I'll say that again. Once a patient has been diagnosed with HIV illness, B20, then you should never assign R75 or Z21 to that patient again. If the lab testing comes back with inconclusive HIV serology, but no definitive diagnosis or manifestation of the illness, then we'll report code R75 for inconclusive serology. With respect to a pregnancy, those codes, of course, would take priority, and it would come from O98.7 and would be assigned as the primary, followed by the HIV-related code of B20. Finally, if a patient is being seen to determine their HIV status, use code Z11.4 and counter for screening of HIV. Use additional codes for any associated high-risk behavior like intravenous drug use, or if there are any signs and symptoms, you would want to code those too. For example, some people, when they are first infected, have symptoms like they would a cold. I would suggest making these notes in your ICD-10 book for quick reference. Knowing these guidelines can help save you time on the exam. Back to the question. When a patient has a blood test for HIV that is inconclusive, what ICD-10 CM is assigned? If we were to refer to our notes, which we just made with all of these listed out, we could easily identify this as inconclusive serology, which is coded to R75 per the guidelines, making B the correct answer. To confirm our understanding, let's find the code 2. In the ICD-10 alphabetic index, look for human immunodeficiency virus disease laboratory evidence, and you are directed to R75. Verify the code in the tabular list. We can see in the tabular list that there is an I icon. This is your reminder to check for proper coding against the guidelines. The correct answer is still B, R75. An HIV positive patient was admitted with skin lesions on the chest and back. Biopsies were taken and the pathologic diagnosis was HIV-related Kaposi sarcoma. Leukoplakia of the lips and splenomegalia were also noted on physical examination. The discharge diagnosis is HIV infection, Kaposi sarcoma on the back and chest, leukoplakia, and splenomegalia. What ICD-10 code should be reported? It would take longer than the suggested 2 minutes per question to code all of these conditions by indexing. Let's use some test-taking strategies to answer this question quickly based on the information we have. According to the guideline, if a patient is admitted for an HIV-related condition, the principal diagnosis should be B20, followed by additional diagnosis codes for all reported HIV-related conditions. Since we know B20 is the primary diagnosis in this case, based on the guideline, utilizing the process of elimination, that means B and D are incorrect. When we review the remaining choices, the only difference is Z21 here at the end of C, Z21. Since that is the outlier, let's look it up directly to see if this provides us any clarification. And we can see here, this has an excludes one note of B20. In ICD-10, an excludes one note indicates that a specific code cannot be used alongside another specified code, ever, highlighting that the two conditions are mutually exclusive. If one diagnosis is present, the other should not be coded. This means that the correct answer is A. Eliminating C because B20 and Z21 cannot be coded together. Patient is admitted to the hospital with streptococcal group B severe sepsis, which has caused pneumonia and acute renal failure. What codes are assigned? We see 4 codes here. And just looking at the codes quickly, they do share a lot in common. A and D both share A41.9. B and C share A40.1, so we'll be able to eliminate 2 rather quickly once we figure that out. And J15.3 is in 3 of the 4 code selections. To find the codes in the ICD-10 alphabetic index, look for sepsis, streptococcus, streptococcal group B, which directs the coder to A40.1 for the systemic infection. After verification from the tabular list, we can eliminate answers A and D, since only B and C contain A40. Additionally, we can see several notes regarding this code. Specifically, there is the I icon, which telling us and reminding us that guidelines are in play when applicable. Let's review some of the sepsis guidelines before we complete this question. There is a graphic on this page similar to the one in your ICD-10 manual, and it's quite handy when you're trying to determine proper coding. If a patient is admitted with sepsis, do they have organ dysfunction? If the answer is no, then the code to report is A41.9 or the appropriate code for the underlying systemic infection. In our case, you might remember the appropriate code for the underlying systemic infection was A40.1, which is sepsis due to strep B. Now, if the answer to organ dysfunction is yes, like in our case, because we have acute renal failure, the next question that is required to be answered is it clearly associated with sepsis? If the answer is no, you are reporting the A41.9 or the specific sepsis code, followed by the specific organ dysfunction. If association of the sepsis and the organ dysfunction is not clearly documented, you would want to query the provider. We also have a note over here that's linked to both of these that says localized infection like pneumonia or cellulitis should be assigned as a secondary code. You remember from our question that the patient also has pneumonia. So in our case, not only would we report the systemic infection of sepsis from group B, but we would also want to report a code for the pneumonia. Our question states the severe sepsis has caused the pneumonia and the acute renal failure, so our question is yes. When you answer yes to this question, it automatically becomes severe sepsis, and then certain codes must be reported. When severe sepsis is reported, you first want to report the sepsis code, either A41.1 if the organism is unspecified, or in our case, it was A40.1 for the specified organism of strep B. Here again is the reminder that the secondary diagnosis code should be any localized infections like pneumonia, which we have here, so we would want to find our pneumonia code as number 2. And then to report a code from category R65.2. Category R65.2 is severe sepsis, and the difference between the codes here is either severe sepsis without septic shock or with septic shock. And then also we want to report additional codes to identify the specific organ failure. In our case, the organ failure is renal, acute renal failure. Now that we reviewed these guidelines, let's run back to the question. We still have A and D washed out. Based on the information we just reviewed, we know that this claim must include a code from R65.2 for severe sepsis. Of the 2 choices left, only B has R64.2 and the associated organ dysfunction with code N17, making B the correct answer using the process of elimination. Let's continue with coding to confirm our understanding. Per ICD10 guidelines CM Guideline 1C14D, if the reason for the admission is both sepsis or severe sepsis and localized infections such as pneumonia or cellulitis, a code for the systemic infection is assigned first, followed by the code for the localized infection. The localized infection in our case is pneumonia and can be found in the alphabetic index by looking for pneumonia in or due to Streptococcus Group B, which directs the coder to J15.3. To locate the code for sepsis, look for sepsis severe, which directs the coder to R65.21. And see how R65.21 is with septic shock, and we're looking for R65.20, the severe sepsis. We also want to report the organ failure, so we'll look in the ICD10 index for failure, renal, acute, referring us to N17.9. Verifying all codes in the tabular list. And then pay careful attention to the instructional notes in the tabular list. It will help you with sequencing in these cases. Answer is still B. In the ICD10 CM, what condition is reported as the default code when the provider documents urosepsis? ICD-10 CM guideline 1C1D1A indicates urosepsis is a non-specific term. It is not to be considered synonymous with sepsis. Urosepsis does not have a default code. If the provider documents urosepsis without additional information, the provider must be queried before an ICD-10 CM code can be applied. Another sepsis question. A 22-year-old Patient, status post-surgery, lower right leg amputation. She's 4 days postoperatively and developed a postoperative deep incisional wound infection. The patient quickly deteriorated and became septic, developed gas gangrene, and went into post-procedural septic shock. With aggressive intravenous antibiotic management, the patient improved. What ICD-10 codes are reported? Okay, the key word here is post-procedural. Everything here was post-procedural. She got post-procedural infection, post-procedural sepsis. So this is a complication of a procedure. Guideline 1C, 1D5, B through C shows the coding order for post-procedural infection with post-procedural septic shock. The first code listed should be T81.40 through T81.43, following a procedure, or O86.06 through O86.03 for infection of obstetric surgical wound. So if I were to look at this list, the only two that meet that criteria so far are D and A, have this as the primary diagnosis code, so D and C are eliminated. Number 2 uses additional code to identify the infectious agent. I'm not sure, but I see A codes, and those are usually from the infection section. T81.12, post-procedural septic shock, do not code R65.2. So we need a code from T81.12 to signify our post-procedural septic shock, not R65.1 like we previously discussed. So this gets rid of all of these answers here for us now, leaving D as the only choice. But knowing what we reviewed and that A, B, and C include R65, meaning they cannot be coded correctly, I would say that D is the right answer like we just talked about. But let's code it out. In the ICD-10 CM alphabetic index, look for infection, post-operative wound, surgical site, deep incisional, referring you to T81.42. Verifying that in the tabular list, the code requires 7 characters. Report T81.42XA for active treatment. The notes under T81.4 indicate to use a code to identify the infection. The guidelines instructs to use code T81.12. Look in the alphabetic index for shock, post-procedural, septic, and you're referred to T81.12. Verification in the tabular list. This code requires the 7th character, reporting T81.12XA for active treatment. Notes under T81.12 indicate code first, the underlying infection. For the systemic infection, look in the alphabetic index for gangrene or gangreous, directing you to A48.0. Code R65.21 for severe sepsis with septic shock is not reported, which is indicated in the guideline 1C1D5C. And our answer is D. There is no mention of other acute organ dysfunction. So the answer is D. A patient with metastatic bone cancer, the primary site is unknown, presents to the oncology office for a chemotherapy treatment. So let's just pause here. They are at the oncology's office for treatment of a metastatic bone cancer, so a secondary site straight away. On examination, the oncologist finds the patient to be severely dehydrated and cancels chemotherapy. The patient receives intravenous hydration in the office and reschedules the chemotherapy treatment. What ICD-10-CM codes are reported? We can see our answer choices on the screen here, 2 presenting with C first and 2 presenting with E first. Per the ICD-10-CM guideline 1C2, B3, when the admission or the encounter is for the management of dehydration due to the malignancy or therapy or a combination of both, and only the dehydration is being treated, intravenous hydration, the dehydration is sequenced first, followed by the codes for the malignancy. In the ICD-10 alphabetic index, look for dehydration, and we're directed to E86.0. Since we know this code must be in the primary position, this eliminates A and C. The treatment is directed at bone cancer of a metastatic site. In the ICD-10 table of neoplasms, look for neoplasm, neoplastic bone. Use the code from the malignant secondary column directing you to C79.51. The primary site is unknown. In the table of neoplasms, look for unknown or unspecified site and use the code from the column malignant primary, which directs the coder to C80.1. And we will, of course, verify the code selection in the tabular list. Because the secondary site is what is being treated, we would sequence first the dehydration, followed by the metastatic site, followed by the primary unknown site. Which statement is true for reporting burn codes? A, burn codes are coded by the anatomical site and sequenced from top to bottom of the anatomical body. B, first-degree burns involve the epidermis and dermis and should always be sequenced first for multiple burns. C, sunburns are classified with traumatic burns and is the only burn code reported. Or D, the highest degree of burn is reported as the primary code. In the ICD-10-CM guideline 1C19D1 instructs you to sequence first the code that reflects the highest degree of burn when more than one burn is present. This makes D correct and A wrong, although we have appeared to have already found the answer. Let's confirm why the others are wrong. Sunburns are not classified under traumatic burns, T20 through T25. These are burns and corrosions of external body surfaces. Sunburns actually have their own set, which is L55, and it's by degree. And first-degree burns are superficial, and they are through the epidermis, so that makes B incorrect. A patient presents to the ED physician for multiple burns. After examination, the physician determines the patient has third-degree burns of the anterior and posterior portion of the left leg, starting at the knee, extending above the ankle. He also has third-degree burns of the anterior portion of the left side of his chest. The patient also has second-degree burns on his left upper arm. What ICD-10-CM codes are reported? In the ICD-10 guidelines, 1C19D1 indicates that more than one burn is present to sequence first the code reflecting the highest degree of burn, like we talked about on the last question as well. Starting with the third-degree burns on the anterior and posterior portion of the left leg, starting at the knee, extending above the ankle. In the alphabetic index, look for burn, lower, limb, multiple sites, except ankle and foot, left, third degree, referring you to T24.392. Third degree burns to the left leg at the knee, extending above the ankle, are coded as T24392. And notice that there is information here about including the appropriate seventh character. Next is a third-degree burn of the anterior portion of the left side of his cheek. Third-degree burns to the left, not cheek, chest. Third-degree burns to the anterior side of the left of his chest. Third-degree burns to the left side of the chest is found in the alphabetic index by looking for burn, chest, wall, third degree, referring you to T2131. And again, when we verify in the tabular list, there is a reminder here that we need a seventh character. The next code is the second-degree burns of the left upper arm, which is found in the alphabetic index by looking for burn, upper limb above the elbow, directing you to see burn above the elbow. So if we look in the alphabetic index for burn above the elbow, left, second degree, we are referred to T22.322. And again, we do need to find the appropriate seventh character. On all of these instances, the appropriate seventh character is A, because this is the initial encounter for the burn. These are the three codes we just found for the three burns. Let's review the question one more time to determine our last code. The physician determines the patient has third-degree burns of the left leg totaling 12.5%, third-degree burns of the chest totaling 4.5%, and second-degree burns of the left upper arm totaling 7%, which totals 24% of the total body surface area is burned. To report the extent of the total body surface area burned, we look in the alphabetic index for burn extent, and in this case, it's 20 to 29%. Category T31 is used to identify the extent of the body surface area involved. The fourth character identifies the total body surface area. This is also known as the TBSA, to the highest degree of burns. The fifth character identifies the percentage of body surface with third-degree burns only. In our case, third-degree burns total 17%. That's the 12.5 plus the 4.5, reporting the fifth character digit of 1. Look in the alphabetic index for burn extent, 20 to 29%, with 10 to 19% third-degree burns, referring you to T31.21. The TBSA codes are only 5 characters long, and you do not need a seventh character to complete the code. These are the answers for this question: T24.392A, T21.31XA, T22.32A, and T31.21. This covers the leg, the chest, the arm, and the extent of the burn. A child is seen in a hospital-based pediatric clinic for active treatment of 10% first and second degree burns to the left calf area and 5% third degree burns on her right hand. What ICD-10 codes are reported? Burns are classified as burns or corrosions in ICD-10-CM. In this scenario, there is no specification as to what caused the burns, but they are stated as burns. ICD-10-CM guidelines 1C19D1 indicates to sequence first the code that reflects the highest degree of burn when more than one is present. In this case, the third degree burn on the right hand is listed first. In the ICD-10 alphabetic index, look for burn, hand, right, third degree, directing you to T23.301. In the tabular list, a seventh character is reported for the initial encounter, which is active treatment. It would read T23.301A. When we review the answers, that choice is not included in B, so we would eliminate that choice. We also know that it must be listed first as it's the highest degree of burn, so that eliminates C for us. Now let's code the calf. ICD-10 CM Guidelines 1C19-2D indicates to code burns at the same site, but of different degrees to the subcategory identifying the highest degree recorded. Therefore, report second-degree burns to the left calf. Look in the alphabetic index for burn, calf, left, second degree, and you are referenced to T24.3232. In the tabular list, a seventh character is reported for the initial encounter. ICD-10 CM Guidelines 1C19D6 indicate a code from category T31 is reported when there is mention of a third-degree burn involving 20% or more of the body surface area. This does not apply in this case, so a code from T31 is not required. The codes in the burn section have a note to use additional external cause codes to identify the source, place, and intent of the burn. This information is not known in this case, so it cannot be reported. The answer is D, since we have nothing else to code diagnostically. Thank you for joining me for this CPB-CPC practice exam review. For more practice exam questions, please visit our website at medicalbilco.com.